regarding hypertension. Hypertension is a simple disease when treated, and it will be complicated when untreated. So whenever you feel some kind of dizziness, breathlessness, or dyspnea on exertion, palpitations, or any chest discomfort, please do visit your nearest qualified physician and go take their advice regarding your hypertension. Is it normal or not? Where your normal hypertensive value should be systolic 120 and diastolic of 80 mm of Hg. If this value goes higher, for 10 points above 130 by 80, it will be like you have to keep checking your BP every month. If the systolic is 140 and the diastolic is 90 mm of Hg, then you are under stage 1 hypertensive condition, which you have to go for a expertise advice and then use your hypertensive medication. Next, coming to little more higher stage 2 hypertension, when it goes above 140 to 150 and diastolic of 100 to 110 mm of Hg, then you will be kept on antihypertensives along with the diet modifications by your physician whom do you visit. So here, coming to the biggest one, which is a life-threatening and very much endangering hypertensive crisis, which is called hypertensive crisis at 180 mm of Hg by 120 mm of Hg of diastolic value. If it is above this, then the patient is categorized as he's in hypertensive emergency, which means literally emergency, because at this stage patient might land up into either cardiovascular or neurological deficits. So once you are land up in that, it's difficult to lead the life to the fullest. Whatever you think, like in your daily works or your job or your daily activities, daily household works for females, it is very difficult for them. Even for their self-grooming, it is very much difficult for them to cope up with the life if they go and land up in hypertensive crisis. So I do suggest people, when if you are having any chest discomfort, palpitations, or any other symptoms of breathlessness during any point of time, please do go for a closest physician and do meet them and have good suggestion. If needed, you can take antihypertensive drugs at regular basis if they advise you. Don't empirically go for OTC drugs of antihypertensives, which are being randomly given nowadays at every pharmacy without prescription. This is very much dangerous, because each and every person has their derived hypertensive depending upon the symptoms and signs they throw. So it is already classified for a group of people. One type of drug is used. So specific molecule is dedicated for specific signs and symptoms. It will be very much better if you take expert advice and start using your hypertensive drugs. And I suggest every person above 15 years, if they're obese, or above 18 years, it's mandatory for them to get their BP checked yearly once they are fine. If they are in hypertensive they are hypertensive patients, they should every month go and check with their nearest clinic, qualified doctors, whoever will be there. Just take one reading of your blood pressure, then you sit back and relax. Otherwise, as I have said you earlier, you have to face all the problems or cardiovascular deficits what I have mentioned you, which is very difficult for a human being to cope up with those in the rest of their life. And mainly, please do stop having alcohol and smoking, and for children, stop taking junk food, as it is very much problematic for you in future.